it is a great pleasure to introduce you Dr. Kevin Yauy. And you can watch in there probably and welcome the view of the speaker. Um, Kevin, say hello.
Hi, everybody.
Hi, there you are. Now we have it in the speaker view. Kevin Yauy is a professor of medical genetics of the University Hospital Medical School in Montpellier, in France, and is also working in a laboratory of technology and microelectronics. So as you see, he's a young man, and he's very interested in using AI. Most of us are to improve medical education. So people is still entering, Kevin, but I
Mhm.
think that if since it's going to be safe, it is going safe already, so there will be no problem, and people will be able to watch it tomorrow, some other day. Tomorrow, the video will be in our web page and in our SEDEM YouTube channel. So thank you very much, Dr. Joey. Is this well pronounced, Joey? Kevin
Perfect.
Joey. And thank you for accepting to give us this seminar based on this wonderful paper that you published in July in the New England Journal of Medicine, which is a great, important journal. So congratulations.
Thank you very much. Thank you for inviting me. I'm super happy to meet you all today. And yeah, I'm happy to present to you some of the work that we have made in Montpellier, which is not far from Spain. And indeed, we try to overcome an issue for us, which was to implement OSCE in France. Since in France, it's only since 2 years we have implemented OSCE for a national exam. So we have less experience than you in OSCE, but we find it really hard to settle, and that's why I experienced how can AI help us to do that.
Very good.
So especially because I do believe that now we live in an era of AI, and so knowledge is so much easier to access. And I think this will shift all the physician and all the med school into really assessing competence. It will be really for me, and I do deeply believe in that, is that tomorrow it will be less MCQs and way more about learning competence and assessing competence. Especially, I think that tomorrow will be physician will be facing complex human interaction and probably be assisted by AI for all the technical aspect, but still all the complex human interaction will be at the heart of what you will be physician of the next decades. And likewise, I was really interested in to see how AI can help us to do that, because indeed, we all, I think, share here the need of this competency-based medical education, and finding ways to transform our medical education to this kind of model that I hope that one day we will reach. Um, and yeah, I will show you some tips, some of a framework that we build to try to make that happen. So it's called USCI instead of USCI. It's really AI standardized clinical examination. We call it that way because we do believe that OSCE was nice, but still it was uh, complicated to evaluate the same way all students, because here in France we see 30 students a day or 40 students a day, so it's difficult to be really focusing on evaluation. And sometimes it was kind of hard to also standardize really well the patient. So we do believe that AI is a way to do that. We built this platform called Doc Simulator, which takes already made clinical cases that teacher have made for in a university, And then AI will automatically take this and create simulations. These simulations are accessible anytime, 24/7 for students. They can train with a virtual patient. And at the end, because it's, I think, to me, the most important part of learning, they can reflect on their simulation. They will have feedback from the AI. The feedback will be based on the skills that, for us teacher, we decided that it was important, and then they can think about it. And what is the most interesting part for me as teacher today is that I don't have to spend 90% of my time settling the simulation, but now I spend 90% of my time just doing a debriefing with my students in here in my services in the ward. I have every week students, and they simulate in the platform, and we spend 1 hour each week just talking, discussing, debriefing. And I think to me, it's really the most interesting part of my teaching. It's really about mentorship. So let me show you how this work. So you will be probably it will be easier to understand how it could work. So here I'm in this platform, and it's currently available in French and English, but it's in beta in Spanish. And yeah, you have this platform, and here we are. It's in one example, and let's train on this one. So I'm a medical intern in emergency department, and I see that I have this patient who's coming because there's something wrong on the biological workup, and I have to interpret the lab results and explain the diagnosis. So let's go. And there I can have a look on the biological report, which was automatically generated by AI. Still, we ask for this. Indeed, she had a really low number of neutrophils, which is an emergency, and that's why she's here. And let's go. So, oh, hi. Um, Tell me what happened. So since I have a lot of doctors and physicians here, so I will be happy to for you to join me and ask questions if you have. It will be interesting to look for what you want to ask for the patient. Who want to try? Okay,
Entonces, dado que tengo muchos médicos y
okay. I'm really sorry. I don't speak Spanish. I'm really sorry. So can you translate this to me in English?
Uh, we cannot listen anything, Kevin.
Okay. We can listen anything. Um, I think I heard that. Uh, do you take any medication? I think that's what I heard, but I was not sure. Okay, if you're working on this, then we know that metamizole can be indeed a treatment that could do agranulocytosis, and then now we're starting to discuss with the patient that we could also discuss using vocal mode. So let's say, since when did you take this medication? So the AI is talking, but I think maybe you don't listen to it, and so on. You can discuss with it, doing like you do as a consultation usually, and so it's no more just assessing just knowledge. It's really about providing students only active learning, and they have to know how to do, especially, and not just know to do how. It's really about it. And at the end, what do they like the most is to getting the evaluation. Indeed, they need to know what they should improve, and this is really the most specific features that they ask for. So because students are really picky every time on notation, So here we built a system that multiple AI is currently evaluating the system to be sure that the notation that we provide is correct. Here, of course, we didn't do well because we didn't ask for the correct information, but you can see which kind of information I should have asked or I should have taken into account and how I should then improve myself for the next simulation. And we can assess really clinical aspect, like I should have said that this treatment could be the cause of your agranulocytosis. And AI could also assess more about, let's say, the communication skills. So we provided some grades, and they can here. Of course, I have 0 because I didn't do anything, but it can also assess this kind of thing. What I like to do the most is that here you can see there's a shareable link. So if I click on this and then I open another, oh sorry, open another um, pages, you can see that I can share this to someone else. So especially what we do here in Montpellier is that when they finish, then send me this link, and then we can discuss about it and go back to the chat and then okay discuss about it. Okay, could you improve this? How can we make it better? Should have you asked it in another way? Why did you choose this word? Why this decision? So it's really about the debriefing that we kind of really expand, because now we can spend time on specifically why they did that. So let's go back to the presentation, or if you have any question, don't feel free to ask if needed. What I like as a teacher is now we can assess competence from students every time we want. And we can do it in the global cohort. So here, for example, we have younger students in our university. It's a clinical cases where we are in emergency and a patient is coming because of abdominal pain. And we were surprised to see that only 20% of students thought about prescribing analgesics. So it means that 80% of them let the patient suffer. Well, we really was really stuck with this, like, oh, come on, we are fourth year in medicine. You should know that. And yes, it made us think about how we should improve probably the way we teach to reach 100% at the end of the 6 year when they're going to be resident. So it's a way to assess competence and actually to help them getting all the competence, all the skills that we believe they should have learned during their training. So as we are all physicians that likes evidence-based medicine, I think there's no reason that we don't do the same for medical education. So we perform evidence-based education by settling randomized control trial on this AI platform. So half of the students have access to Doc Simulator for 2.5 months. Half of the students doesn't have access to Doc Simulator. And so we did this randomized control trial, and at the end, we assessed their competence on the faculty OSCE exam. And we were happy to see that students that have access to the platform perform significantly better with a dose effect. The more they use it, the better skill they have. But what makes me the proudest is that they reported a better mental health. We all know that medical school is really stressful, and I was happy to see that they feel uh, less stressed, have a better enhanced emotional preparation, and most of all, they went all to the exam, to the OSCE exam, which usually, since it's something really new in France, the last 2 years, there's some student who doesn't want to do the exam because they feel that they wasn't ready to do it. So we're happy to see that all the students that have access to the platform went to the exam. Training skills is important, But the other aspect for us that is important is to evaluate skills. And usually it's hard for us to evaluate the competence, the skills of the students, because settling OSCE takes a lot of effort. So here it's a way to really facilitate a way to assess clinical skills. And we collaborate with another university with guys who doing podcast. So I don't know for you, but I like really a lot to listen to podcast. But what it was interesting to see is that actually there's no uh, kind of clear evidence of the benefit of podcast to gain clinical competence. So it was not assessed. So we were thinking about how can we assess that podcast could be helpful to learn and to gain competence. Well, we assessed a randomized control trial on the dog simulator platform. Half of the students doesn't have access to the podcast. Half of the students have access to the podcast. Classic medicine, and then we can have a report and show that indeed students who have access to this podcast specifically made to train for clinical competence in nephrology have better scores at the end on the USCI. So it was the first evidence showing that probably as teachers we should do more podcasts because it seems that students that currently is trained like podcast and they learn stuff with it. So we were happy because now we started this project in 2022, so 3 years ago. Last year, we have made access to 50 simulation, and we have 800,000 simulation that was played, and I was happy that almost all students play the platform a lot to their training. So for us, having this number is really impressive because usually student doesn't really use all the tools that we provide for them. So we settle a lot of different mock exam sessions during the year, and so they can have their ranking. Since in France, they will be ranked according to OSCE exam, and according to their ranking, they will select the specialty and the city they're going to work as a resident. So it's really important for them. The last experiment that we made last year was to providing this mock exam, but as another level. So here there was 7 sites that have access to the platform, and we could have made a simultaneously 600 of students playing a lot, doing a complete OSCE session with 10 different sessions. And so it was a technical really achievement, but we made it happen and we were happy to provide this scale of simulation to the students. And this is kind of to me a beginning of something. So we are currently I can show you that finishing all the aspects for institution for teacher. To me this platform is interesting only because it's a platform that was made for teachers and students and administrative people and staff. It will be helpful for us as teacher only if we think about it as a tool that we can implement it in our teaching program. And so we are currently finishing all this development. I can show you where we are. And yeah, we are also finishing the vocal mode to be more accurate. And at some point, one day, my dream goal, I had this 10 years ago, but maybe we will succeed in that, is to settle the first international multi-language randomized control trial on medical education. And I think thanks to AI, maybe we can reach to that and successfully provide medical education like other medical specialty and provide this kind of evidence that I think if we can reach, then we will have high quality evidence, especially because tomorrow, as all technical aspects will be um, assisted by I do believe that tomorrow
Ya se ha ido.
the
Lo ha dejado
care will
arreglado
be really
todo.
about
Diana se,
the
sí, Diana se ha ido. El niño está dormido.
thank you.
Uh,
No worries.
excuse me, it was a guy who entered and
Yeah,
I
no,
muted you instead of the other guy.
no worries, no
Sorry.
worries. And yeah, and I'm almost at the end of this talk actually, but we are currently working because since the publication in the New England Journal of Medicine, we have like I have so many people that were interested in the platform. I'm so happy with that. But a lot of people are asking for to access to the platform. So I'm currently working with a company, finding a way to make it accessible to other university, and we have already started to work with pharmacy and nursing because they were interested in Montpellier. So they start this year using this. And yeah, I was happy to discuss with you, know more about what you do as an experience on AI in medical education, and I will be happy to collaborate if maybe one day we will succeed to settle this randomized control trial, multi-language, international on medical education. Thank you for your attention.
Thank you. Well, wonderful. Wonderful. I think it's your goal, your life goal. It's great. You have a wonderful idea, and that would be really great to have this um, multilingual word OSCE, right? So, okay, so you can count on us, although we are not a medical school, SEDEM, but we have a contact with all the medical schools in Spain, and I'm sure some of them will be interested in working with you in your platform, Doc Simulator, which is so. If I understand correctly, at the moment you had everything written down, but you are um, uh, putting the vocal mode. No, you are adding voices to the simulation. No.
Yes, yes, yes. We have already, yeah, we have already adding all the Volcker mode that they can show you here. But what I
Uh,
believe is that now AI could reach like as you do with ChatGPT. You know, you can open a vocal assistant and then you just make the discussion like this. So I think we can improve the vocal mode that we have already in the platform. That
mhm.
I hope will be more immersive. So that's
Yeah,
something that we have to work on to improve it even better.
very good. So, and Doc Simulator is made with ChatGPT. Is a GPT.
Duck Simulator is working. Actually, it's agnostic to any model. So there's
Uh-huh.
some people who want us to work on Mistral because it's in French, and this is
Yeah,
working already.
yeah,
Uh, so sometimes it's more about the cost. So we are going to reach more about a model that is cheaper. So what we really I think what we built and what is important is to uh, really find a way to know how we do as teacher and create like the car, and the motor of the car would be could be any kind of AI, but the whole car, the doors, the wheel, all of this, I think this is specific to medical education, and this was important for us to create.
very good. And I think you have 48 cases right now.
So this was last year. So now we
Last
have
year
more.
we have
We-
some more. So and I guess the cases may be created by AI, but are controlled by medical doctors,
Ah.
right?
So good question. So let me show you a bit how we can create cases. So oh, I have to connect again.
You
So
have it in Spanish, this webpage.
so yeah, we are currently doing multiple language that ask for us,
Very good.
but yes, so
Yeah.
you can create like this. So you provide the context, you provide the instruction, and then you ask for the patient, and you
Hmm.
provide all the information that you want.
Okay.
So in France, we have an Excel file, so we can fill, if you have made already the Excel file of ASCII, then you can just upload it and then it fill already automatically for you. And we are currently working on assistance of AI to create this. But to me, at the end of the day, it's still um, us as teachers who decide what we want and what we want to assess, and especially here on the criteria that we want to assess during the consultation. That we
Mhm.
can you can select what you want to evaluate for students. When you have created one, then you have a place for teacher, then you can try and you can also comment, discuss about it, and then when you're ready, then you can publish it for students.
Mhm.
This is
Mhm.
how that kind of work. So this year we have a lot this kind of cases that was uploaded. Then we have played it, modify it again, and then when we're ready, we're happy with that. We publish it accessible for students, and afterward they have access to the exam every week, and then they can be assessed in that sense. So it was kind of it's kind of the way the platform works is really to having not too much effort for teachers. If you have in France, we have already created all these cases in an Excel file, then just upload it and that is good.
Mhm.
Otherwise, you can do it by yourself, and then the student have access to it, and you have access to a lot of information. Like here, for example, you can reach for okay. Here we are in a demo mode. That's why we don't have a lot, but you see that yes, one evaluation, and you see that you can see the global skill
Mhm.
assessment for your student on this. So it's still work in progress, but we're kind of happy with what we made already, and it's currently used by our student every day. So it works well, but to me it's not finished yet. We have
Yeah.
things to do.
Okay. You need more time to improve it. Okay, but I think is great. So I think we can open questions from the audience.
I'll be happy.
We can stop sharing, Kevin,
Yes, of course.
and so we
Nope,
can.
that's done. Mhm.
Bueno, pues estamos a disposición de la audiencia para que pregunten lo que necesiten del doctor Kevin Joy. ¿Alguna idea? ¿Hay alguna facultad de medicina ya usando alguna cosa parecida? Roberto de los Úa tiene la palabra. Roberto de los Úa has the word. Okay.
Yes, Kevin, thank you for this nice talk. Yes, a question. On the feedback you provide to the student, are you able, or Doc Simulator can track the progress of that study on the subject you are trying to evaluate or the competency you are trying to evaluate?
Super interesting. Thank you for this question. We are currently working on this, and especially that we are starting I think the first cohort of the students that we're going to assess with AI and Doc Simulator, and so we are including the student right now actually. So we are thinking about how to make it properly, and we start this year with the youngest student in med school. So they have access for learning semiology. They will have access to Doc Simulator, and we will assess this. And the aim of for us will be 3 years from now, when they will be a resident. We will find a way to analyze this and see if will be able to do that. And hopefully, every year we will assess the competence that they reach, see what they succeed, what it doesn't succeed, and provide them feedback of okay, you for anamnesis asking questions, you're good, but maybe you're not good in this, and you should improve on that. So it's really something that we are thinking. We are implementing this year, and it will be really interesting to see all the research that we can do from that.
Very good. Any other question? I will ask you, Kevin.
Yeah.
I think you said that all the students in medical schools in France have to pass this ASCII, well, not this ASCII, an OSCE to enter the postgraduate education. No? So
Yes.
is that
Yes.
correct?
Yes.
Who
It,
organizes this OSCE in France?
so it's a national exam. So it means that all the faculty in France are synchronized to do it at the same time.
The OSCE. The
The
OSCE is
OSCEs.
made by all the schools at the same time. Yeah.
Yes, and so what we do is that we team up with our neighbor, so with Marseille and with Toulouse, and we switch teachers so we can assess students for OSCE, but to make it fair, because if the students see their own teacher, it can have some biases. So
Yeah.
that's what we do, and
Yeah.
it took us a week to settle the complete OSCE session, national OSCE session that we do every year.
Okay. And then to these results, these OSCE results, are used by the ministry to make some list or students, or how is it then organized to enter the postgraduate education?
So indeed is that way. So every students are assessed by two teachers. Then they have a notation. From this notation, everything is centralized from the ministry, and then they provide a ranking list. And from this ranking list, students from first to last can select the specialty they want and the city they want. They will be trained for a resident.
Well, very good. Jennifer has a question. Adelante.
Hi, Kevin. Thank you very much. Your platform is very interesting. I like it a lot. And I was curious, I missed it at the beginning of your talk. I didn't hear, is there a cost to use this? How do schools sign up? How does that work?
Good question. Thank you, Jennifer. Indeed, it's using AI is a cost. Every time you use it, it's like fuel. Every time we use it, then there is a cost. So currently, yeah, we had a funding, research funding. So we fund everything with this, and usually the cost currently is around €1 per simulation. So the cost is real. I mean, it's not cheap. It's not expensive, but it's not cheap. Because at the end you don't have to find people, finding places, and I think that I've seen some of the publications saying that it's like €30 per simulation if you have to do this in the university. So but still it's this kind of price. So I hope that for the next years cost will lower, because AI is becoming more cheaper. But still, for now, we are around this pricing. So since this platform was a collaboration from the University of Montpellier and a company, we made that together starting to 2022, so a long time ago, in the AI world. They provide access and demo access if you are interested, and they it's their job. For me, I'm really about the academic part and how we make it happen here in Montpellier, and creating all the research section. But if you're interested, I can make you in contact with them, and they can tell you more about how you can have access to the platform.
Okay, and you said it was in beta right now for Spanish, right? You have it in English and French.
Yes, but it will be accessible like next month or in 2 months.
Okay.
So it's really like I've shown you already. It's almost there.
Okay. And then I'm curious, did you use this? Have you used this for an exam, or have you used it just for practicing with students?
Good question. Interesting. So we are currently this year, um, uh, we do the transition for semiology. So we will perform MCQ exam and USCI exam for semiology, and we're going to assess that this year. I'm pretty sure there will be a lot of difference between both of the assessments, and we will see that we can make it accessible, it works, and everybody's happy. But if this year's works, then the next year we will stop MCQ and we will do ASCII instead. And we'll put that into the faculty official evaluation for semiology. So it's our goal for the next years, and this year we are doing it in parallel.
Okay, great. Thank you.
Very good. Very good. So remember, when you have that ready, give us an email. Send us an email so that I'm sure that we will collaborate with you, and maybe we can also prepare cases, clinical cases based on Spanish heat waves or probably also other possibilities. Okay, any other question? Okay, pues very good. So I think you already finished for today, Kevin. You can go home now if you wish.
Not yet.
Not yet.
I
Okay.
think you too.
Well, thank you very much, and remember, we would like to be in touch with you, and someday, hopefully, we could try and use your simulation. We will make all the arrangements necessary and contact our medical school, so that I think would be interesting for them. So thank you very much, and well, I hope we see you soon.
Thanks to you. Thanks for your attention, and happy to collaborate for the next years.
Okay, thank you.
Thank you. See you.